Hello everyone. Today I'll be presenting on physiotherapy in respiratory failure. So this is a critical condition in which the respiratory system fails to maintain adequate gaseous exchange. So it is commonly seen in emergency and ICU settings, and early recognition is important for patient survival. So coming to the definition, so respiratory failure is defined as the inability of the lungs to maintain normal levels of oxygen and carbon dioxide in the blood. So normally our lungs oxygenate blood and remove carbon dioxide effectively. So but in a respiratory failure the balance is disturbed, so leading to hypoxemia or hypercapnia in such conditions. Yeah, there are two types. The type 1 is nothing but hypoxemic failure, whereas type 2 is nothing but hypercapnic failure. In hypoxemic failure, there will be low oxygen levels in the blood, while carbon dioxide may be normal or low. Whereas in type 2, that is hypercapnic respiratory failure, occurs when carbon dioxide levels increases due to inadequate ventilation. So this classification helps to decide the treatment approach in certain conditions. So coming to the clinical assessment, there are four types of clinical assessment that can be done. So the first thing is respiratory failure and pattern. So the first thing is normal respiratory rate is nothing but as we all know it is 12 to 18 for a normal adult, whereas in such conditions patient will be experiencing tachypnea, that is increased in respiratory rate is present. So sometimes auscultation is also done to such patients. So auscultations makes us to find out whether if there is any wheeze, crackles, rhonchi, underlying pathological conditions can be seen in auscultation findings. Whereas oxygen saturation is also being seen. That could be either a partial or partial pressure. So that is saturation that is below 90 percentage said to be in severe cases. So vital signs trends, that is nothing but general vitals like blood pressure, heart rate, temperature, all those things are seen in such patients. So some things might be deteriorated in such cases. So goals of physiotherapy, so what is our goal in such patients is nothing but the first thing is we need to improve ventilation and oxygenation in such patients. So only then we could move on with further things. So in such things oxygen therapy is being prescribed to such patients, and we must also encourage the patient to expectorate the secretions. If not possible, we'll be aiding clearance techniques, that is secretion clearance techniques to such patients is also being given. And to prevent the complications like deconditioning or DVT because of prolonged immobilization or bedridden must also be taken in concern. And we also must restore the functional independence of the patient, so that is the improvement of activities of daily living or to improve the quality of life of the patient is also being taken in consideration. So as we all know airway clearance techniques, so hands-on strategies, that is evidence. So the first thing is manual technique. First and foremost, as we all know, is postural drainage, in which the patient will be positioned in gravity assisting so that the secretions will be taken with the help of gravity. The second thing is manual chest vibrations and percussions will be given to mobilize the secretions of the patient. And ACBT, that is active cycle of breathing technique, is also given to such patients to mobilize the secretions and to improve ventilation of such patients. So whereas certain secretions will be very stubborn and cannot be expectorated with the help of manual techniques, so in such conditions we'll be opting for equipments like PEP devices, that is oscillatory positive expiratory pressure, that is OPEP devices like flutter, acapella and aerobica kind of stuffs. And high frequency chest wall oscillation machines will also be like a vest therapy will also be given to such patients, so in which the patient will be wearing a vest and the vibrations or shaking or percussions will be given mechanically to the patient with the help of a machine. So thereby we'll be mobilizing the secretions and expectorating from the patient's chest. And certain breathing techniques will be educated. The first and foremost thing is diaphragmatic breathing, in which we'll be focusing on the work of diaphragm muscle rather than any other accessory muscles of respiration. So the second thing is pursed-lip breathing. So in pursed-lip breathing we'll be making the patient to purse their lips and breathe, in which it helps to ease their breathe of the patient without any struggle or discomfort. The other thing is inspiratory muscle training. So as we all know, the inspiration is the major concern. So the muscles for inspiration is being trained in such conditions. So this